In this video, we're going to discuss two lookalikes in dermatopathology that I feel like people sometimes get confused. This is Molluscum Contagiosum, and sometimes people confuse that with a type of plantar wart, Myrmecia Wart, which is a type of verruca plantaris or palmaris. And I'm going to show you both and explain the differences between them. And this is a classic example of Molluscum Contagiosum. These present as umbilicated papules on the skin of usually of kids, but it can also be seen in adults. And it's caused by a type of pox virus. And these are benign, indolent things that eventually will go away on their own, usually, or you can get them treated. So what they look like clinically is they look like a little papule that has a little divot or depression in the center. And you can see perfectly on this shave biopsy that we've got a papule. And then in the center, we've got a little depression, a little umbilication. It looks kind of like a little dimple in the middle. And so this cup-shaped appearance is very classic for molluscum. And then let's go closer and look at what makes it so special. In the cup-shaped invagination of the epidermis is lined by keratinocytes. And these keratinocytes can be kind of enlarged and sometimes look a little atypical. But the most important thing that you see here is these big kind of homogeneous pink blobs, these globules. These are composed of viral particles, these big pink to purple colored blobs, and you can see that they originate in the keratinocyte lining of this kind of invaginated depression here. So in these keratinocytes you get these globules. These are called Henderson-Patterson bodies or molluscum bodies, and they're made of viral particle, and they start here in the keratinocytes and then they work their way out into the central kind of cystic space in the middle of the molluscum lesion. So see out here, even in the kind of keratinaceous debris in the middle of the lesion, you can still see the molluscum bodies, or the Henderson-Patterson bodies. They kind of have taken on a purple color here. I think the most important things to recognize that they are very, very uniform in size and shape. They all look kind of like each other. Let's look a little closer, and they have this kind of smudgy, glassy pink appearance. And again, they're composed of a bunch of viral particles. And then note, these are different than regular keratohyalin granules. See in the background, there are a bunch of big purple blobby keratohyalin granules too. But these, the molluscum bodies are different from those. So this is a nice example of molluscum. And when you get a nice section right through the middle of one, you'll often see how it opens up to the surface of the skin. But sometimes, actually probably more often than not, what we get instead is this scenario where the lesion is kind of sectioned through just a little bit to the side of that central umbilication, and so it has a tendency to look like a little papule with a cyst underneath it. So you can see it's kind of bulging up from the skin surface, but within the dermis is this kind of cystic area. Now if you cut deeper, eventually you'll often see this open up to the surface, but you don't need to do that. You can clearly tell, even from this power, this is molluscum, because look, it's got those beautiful Henderson-Patterson bodies. So those are really the key to the diagnosis, and if you don't see those, sometimes molluscum can rupture and become very inflamed. I've seen times where it really looked like a little abscess, where it made granulomatous reaction around it. I've seen times where just the squamous epithelial islands were there in the dermis, and they look kind of atypical and actually were concerning for squamous carcinoma. And then on a deeper cut, you found some molluscum bodies. So I think that it's really important to always keep molluscum in mind. It has the epithelium has this kind of distinct appearance. It kind of pushes out in multiple little lobules like that. And I think there's something about it that just has a very distinct appearance once you've seen it a few times. So I've seen a few where I thought, oh wait, that looks kind of like the epithelium of molluscum, and then I cut deeper and I found the molluscum bodies. So it's a good thing to think about. And you can see here this one's got a little bit of rupture and a little inflammation around it. And again, the molluscum bodies, they start in the keratinocytes, and then they work their way out into the luminal space in the center and kind of get mixed in with the dead keratin in the cystic space there. So that's Molluscum contagiosum, okay? No problem, right? Now let's look at its competitor. So this is a Myrmecia wart. It's huge. It's hard to get it on the slide. And let me give you a little frame of reference. This is from the bottom of the foot, from the sole, and you can see the normal level of the skin would be like right here, okay? And so this lesion pushes up and makes kind of a mound on the skin surface, but also it goes way down below. It's kind of pushed down in a kind of cup-shaped fashion as well. So I can see how that can sometimes have a little similarity. That kind of cup-shaped depression can kind of mimic molluscum in some ways. But one difference you can see even from low power is instead of it being kind of a cystic area down here, there are multiple papillae, these finger-like processes sticking up in the middle of this cup shape. So even though it's kind of a cup-shaped depressed lesion, it has like multiple fingers sticking up, and these fingers are composed of squamous epithelium, just like a regular wart would be. And they'll have all the features you'd see in a regular wart. They'll have the dilated vessels in the center of these papillae. They'll have perikeratosis up over the tips of the papillae. They'll often have hemorrhage like that. You can see above this, here's a papilla. And then up above here, you can see this little spire of perikeratin, and then some hemorrhage, some blood caught up in the middle of the corneal layer right there. See, there's hemorrhage. So it's got all those things, but I'm sure by now you've noticed, yeah, but what about those big blobs? Why aren't you talking about those? Don't worry, we'll talk about those too. The big blobs that you see in Myrmecia wart, this is the reason that people often get this confused with molluscum, because those blobs do look kind of that magenta pinky color that are kind of similar, and they're very large, and they look very different from anything else you usually would see in the skin. So sometimes I can see how you could say, well, that looks kind of like molluscum, those big globules. But there's one big difference that you probably can notice already. The globules here, these kind of like big granules in the cytoplasm, are multiple different sizes and shapes. Some are big, some are small. They're very irregular in shape and in size as well. See, some of them over here are starting out as little tiny little granules or globules, and then they get big and kind of irregular, but they do have kind of a similar color and kind of smudginess that's similar to what you'd see in molluscum. But they are not at all regular in size and shape, and I think that's the most helpful thing. Just looking at the little inclusion-like globules themselves, that's the most helpful way, I think, to tell them apart. And the name Myrmecia comes from, my understanding, because it comes from Greek for ant, and there's actually a certain genus of ant that is called Myrmecia. And so the reason is that some people thought, people with a good imagination thought this looks like an anthill with each of these little granules or globules representing a little ant. So they're like ants swarming on top of an anthill. So sometimes dermatopathologists have very good imaginations, and we can imagine things that other people would never see. So in any case, this is a nice example of Myrmecia wart, which again is a type of plantar wart. Usually I've seen them occasionally on the hands as well. But one thing I'll tell you is I've almost never seen them aside from acral skin, the palms or soles, fingers or toes. That's almost the only place. I think one of my colleagues saw one once in another location. I can't remember, but very, very uncommon. And on the flip side, molluscum, almost never, I've never personally seen a case of molluscum occurring on the palm or the sole. So right away, that can help you out in telling apart, even before you even look at the case. If it's on the palm or the sole, the chance of it being molluscum is very, very low. If it's away from the palm or the sole, the chance of it being a Myrmecia wart is extremely low. So I think right away the clinical can help you there. But the other things that help you is that if you see that you've got all these papillae sticking up in the middle of the lesion, that would point towards Myrmecia wart. And if you have many different sizes and shapes of those little inclusion-like pink, purple globules there, see, I'll focus in and out so you can kind of see the refractile nature of these globules. Again, that variation in size and shape is really good for a Myrmecia wart. Now what I'm going to do is I'm going to go and show a few test cases and see if you can figure out, when I show them, if it is Myrmecia or molluscum. Okay? So let's see here. Here's a shave biopsy. It's kind of in a little bit of pieces, so this might be a little harder. You can't really see the architecture here. You can't really see the shape very well or tell if it's cup-shaped or has finger-like projections or what. But just looking at the granules, What would you think? Is this molluscum or Myrmecia? Well, look at the many different sizes and shapes here. This is an example of a Myrmecia wart. And actually, you can see there are papillae here. They're just cut at a funny angle. See, each of these little islands is probably a papilla. Each of these little islands here. This would be like one papilla with the little papillary dermis within it, and it's just cut at an angle. And if we go up here, we can probably see, yeah, see we're on acral skin, the thick corneal layer, and in here is it's going down to make a kind of cup-shaped, invaginated, depressed lesion, and then sticking up from that are one papilla, another papilla, another papilla. So these little finger-like projections sticking up from the middle of the cup. So this lesion goes way below where the shave went to, and that's often the case in Myrmecia warts. The dermatologist will often do a nice thick shave, but even still, it only begins to sample the top of the lesion because these are usually deep, painful warts, and they're caused by HPV type 1. So there are lots of different HPV types, but HPV type 1 are associated usually with these kind of larger, deeper, painful plantar warts that have this Myrmecia appearance with all the little globules. So again, Myrmecia warts. Okay. How about this? This is kind of cup-shaped. I mean, you could argue that there's like a little bit of a warty appearance here in the middle. But look at the globules. Perfectly regular. They all look very much like each other. I guess they get a little smaller when you go up into the corneal layer. But really, to me, these look very similar to one another and similar in size and shape. And they're that smudgy kind of pink color. And this would be an example of Molluscum Contagiosum. And if you're not so sure, look out to the side. We're not on acral skin. We're somewhere else in the body, away from the palms and soles. So that's another useful clue. Well, here you can see this is a kind of granulomatous dermatitis in here. There's some granulomas, mixed inflammation, a lot of different stuff kind of going on. You could, get concerned about some sort of infectious process at first glance there, granulation tissue. But then when you look over here, look what you see. These kind of little invaginated lobules coming down from the skin surface. Kind of hard to get the shape of the lesion here actually because it's so kind of distorted and ulcerated. But when you go down and look, in these little invaginated lobules, pink, smudgy inclusions that are all relatively similar in size. This is Molluscum Contagiosum, and like I said, molluscum can rupture and give this really, really impressive inflammatory response here that can be problematic sometimes diagnostically if you don't see the Henderson-Patterson bodies. So that would be molluscum. Okay, here let's go to, this is the lowest power we have, and we still can't fit the whole lesion in the slide. You can see it's kind of a cup-shaped invagination, but in the middle it's got very nice papillae that have perikeratin, some little foci of perikeratin over the tips of the papillae, and you can see the granules here, these kind of pink to magenta colored granules, and look, they're chunky and choppy, kind of like they're all chopped up into many different sizes and shapes. They're not as round, they're kind of more angulated, I think, than the granules of molluscum. So these little inclusion-like granules here, these are actually an example of Myrmecia wart. So not molluscum, Myrmecia. See, not so bad to tell them apart when you compare them side by side. And you can have a little bit of similarity that cup shape can give you that low power impression that resembles molluscum. But again, when you go look closer, you can see that the granules are very different actually. Once you've studied them side by side, those granules look very different from these regular Henderson-Patterson body globules that you see in molluscum. So here's an example of molluscum that actually looks like a cyst, but you can tell, see, it's a nice kind of dome-shaped papule on the skin, and probably if we cut deeper into the block, at some point this will open up to the surface, but here at this angle it actually has a nice cystic space, so kind of pretty, I think, It's got a nice cystic space in the middle, and all of those Henderson-Patterson bodies kind of accumulate in there. I feel like molluscum looks like a much more orderly, kind of organized lesion, whereas Myrmecia wart looks kind of like out of control because there's so many different granules of all these different sizes and shapes. I guess that's where the anthill idea kind of came from for Myrmecia. But this is Molluscum Contagiosum, and it's got kind of a cystic shape, so a nice example of one. And I think it may be hard to tell on the video, but a lot of times Myrmecia warts are much larger than the molluscum. I've seen some big molluscum lesions, but usually molluscum is pretty small, and Myrmecia is actually quite large. So you can tell usually when I have to go all the way to lowest power and still can barely fit the whole Myrmecia wart on the slide. But what about when you have a small biopsy like this? You can't really see the cup shape. It's a little bit hard to tell where you are for sure, although right there that's a pretty thick corneal layer. And so we're kind of left looking just at the higher power and seeing, what do you think? Does that look like molluscum or Myrmecia wart? And again, the granules, all sorts of different sizes here. You got very small ones, big ones. They're all kind of angulated in appearance. And this is an example of Myrmecia wart. And also the nuclei, I think, are a lot larger. The keratinocyte nuclei are a lot larger because these are virally infected cells with HPV virus. And HPV virus, I think, tends to kind of make the nuclear changes, some kind of prominent nuclear changes in verruca. So you can see kind of these larger nuclei, and they kind of have this viral look to them a little bit. So I think you don't see really coilocytes per se like you would see in some other types of wart, but the nuclei do get very large and kind of have a little bit of a homogenized chromatin pattern. But you don't usually have to go looking at things in that detail. Just looking at the granules and the clinical setting is usually enough to easily tell. So this is just a thin shave biopsy, and it is from acral skin, although it's hard to be sure of that, you know, when you just have a thin slice like this. But this is an example of Myrmecia wart that's just a thin little shave of it. All right, well, this is a little bit bigger lesion, and it's kind of got two lesions, one here, and it's kind of cup shaped, and there's some like finger-like projections in the middle. So you could say, well, it could be a little warty. Maybe it's a Myrmecia wart, do you think? No, I'm just trying to trick you. Look at those Henderson-Patterson bodies, perfectly regular, beautiful. Very nice, and we're on, of course, thin skin, somewhere away from the palms and soles. And so this is probably one lesion of molluscum, and then another, its little buddy right next to it. So it's a nice shave. It's two for the price of one, so that's kind of fun. And you can see here that this particular molluscum lesion has probably been picked at, and it's beginning to ulcerate and have some necrosis here at the surface. And there's a lot of inflammation down here. And again, this is an example. See these little lobules here of squamous cells? You know, those kind of, if you just see lobules like that and they're in the middle of the dermis and there's some inflammation, you could start to wonder if you're dealing with a kind of a little focus of invasive squamous cell carcinoma. See, there's some mitotic activity, and so they can get kind of some reactive atypia that can cause people to get a little disturbed. And so I know here it's really obvious that it's not squamous carcinoma, but I certainly have seen times where a small sample, a small portion of a molluscum lesion was concerning microscopically, and it wasn't until deeper sections showed that, the molluscum bodies, the Henderson-Patterson bodies, that it became very clear that the whole thing was actually Molluscum Contagiosum. So it can sometimes be a challenging mimic if you don't see the viral inclusions. So that's an example of molluscum. So I think that pretty much does it. Let's see if there's any other ones to show here. Maybe we have one more. So from low power, that's really nice example of the kind of cup shape that you can see is actually coming from this in-towing or inward pointing of the rete, and that's typical of warts in general, that the rete ridges towards the periphery of the lesion push and point in towards the center of the lesion. And then in the middle, you can see one papilla, two papilla, three papilla. You can see all these papillae, these finger-like projections sticking up, and you're clearly on acral skin with a really thick corneal layer. And so you don't even have to go to higher power to see the granules yet. You can tell that this is going to be a Myrmecia wart. And the granules, of course, confirm it. They're all sorts of different sizes and shapes. And there's just millions of them, it looks like here. And they kind of, depending on the quality of your H&E stain, they can kind of vary from pink to more bluish, hazy, kind of bluish purple. So the color can vary a little bit depending on the type of H&E stain you have. I've seen them kind of vary from being real pink to being more of a purplish blue, kind of like this. And I think this slide is a few years old, and so sometimes over time the color of H&E slides changes a little bit. So nice example. I enjoy seeing Myrmecia Wart and Molluscum because I think these the inclusion like granules and the Henderson-Patterson bodies are kind of pretty to look at microscopically, and also they're both benign lesions and they're easy to diagnose once you have learned how to do it. So I always enjoy seeing cases that are easy for me to figure out. I hope that helps you sort out Molluscum Contagiosum from Myrmecia Wart.